Greetings, MedStar associates. Today, I want to press upon you the importance of increasing access to healthcare and how telehealth can offer that provision now and will after combating the COVID-19 infection. The agenda for today is as follows. First, I would like to give an introduction. Then we'll discuss the executive summary, problem definition, impact analysis, root cause analysis, solution, program components, and the ask. Introduction. My name is Brian Smith, and I have recently joined the MedStar Telehealth Task Force managing provider procurement, training, and education of the MedStar eVisit platform. I am pursuing my master's in healthcare management. I received my bachelor's in family youth community sciences, and I have 3 years of experience in clinical education. Our executive summary. MedStar eVisit is a direct-to-consumer telehealth service that provides on-demand urgent care type medical services. Briefly, patients usually from the home and from a smartphone download an app and request care and treatment plans. A MedStar provider completes an evaluation and plan via a video encounter. The service was stable but had relatively low volume prior to March 2020 and the COVID-19 public health emergency. To meet community demands and ensure alternatives to urgent care and emergency departments in the initial response, MedStar Health made the decision to provide the service for free. After stabilizing the service and the community needs, we are intending to start charging for the services again. Insurance will cover the services for those that have coverage, including Medicare and Medicaid. Those without insurance will be charged $50 to $70. MedStar Health is very concerned about ensuring that those without insurance and the ability to pay still have access to care and navigation, especially for meeting the COVID-19 public health need. It is the goal of this change initiative to create a process to identify those patients with needs for services and who cannot pay for them, and developing the mechanism to provide those services to be reduced or to be free. Our problem definition. So the problem definition is as follows. Health systems in the District of Columbia, Maryland, and Virginia have struggled to provide extensive access to quality care to underserved and impoverished populations. Due to the COVID-19 crisis, MedStar Health has created a gateway to provide a means of healthcare to all in need during this state of emergency through the telehealth services. In the event that the state of emergency is lifted, MedStar Health will begin to charge patients for their telehealth visits, and those who cannot afford to pay will most likely opt out of the services, decreasing their access to healthcare once again. Impact analysis. Access to comprehensive quality healthcare services is important to promoting and maintaining health, preventing and managing diseases, reducing unnecessary disabilities and premature death, and achieving health quality for residents in the DMV. About 17% of district adults have no health insurance. Some 50,000 people at any one time and 75,000 at some time during the year have a lack of health insurance. Lack of access to healthcare can cause more stress on clinicians and clinical staff. Patients have chronic illnesses due to lack of preventative treatment, and providers are less productive due to more treatment of sicker patients. Root cause analysis. So our root cause analysis encompasses social determinants of health, which has limited quality options to healthcare, vulnerable and underserved communities and populations. COVID-19 has further revealed health disparities and the inequalities that inhabit populations from accessing healthcare. Pre-COVID-19 average patients that were seen via the telehealth platform was approximately 192. During the COVID-19 healthcare crisis, there were approximately 5,292 seen per month. The correlation between free healthcare and higher rate of participation within the platform is undeniable. And as you can see on the graph, there is an extensive increase in patient interaction with the platform, and a majority of these patients are those who have not paid for the service due to the fact that they could not pay for the service. So what is our solution? We would like to make a recommendation. The COVID-19 infection global health emergency has intensified the value of healthcare providers deploying telehealth solutions. As individuals try their best to manage home and social distancing worldwide, telehealth has become a gateway and opportunity to receive healthcare services, even for those who normally cannot afford to pay for healthcare services. Telehealth can help reduce the spread of COVID-19 infection and other airborne infections, reduce the amount of in-hospital patients, and reduce the use of other resources that are needed by more patients who are sick, to be reserved for those patients most in need. Federal regulators and healthcare systems understand the potential of telehealth and have changed a variety of laws and regulations and policies to enable healthcare providers to deploy solutions quickly. These changes can provide lasting benefits for the use of telehealth well after the current crisis. However, to best realize telehealth's benefits, it is important to continue the free telehealth services that MedStar Health has provided even after the presence of the healthcare emergency for those who are unable to pay. So our recommendation is as follows. To continue to improve access to healthcare, it is essential for MedStar Telehealth to continue to provide free services to those that cannot afford to pay in the following ways. MedStar Telehealth will initiate a coupon code system that will enable all those that are eligible to access the platform for free or a reduced price. Program component. How do we make this happen? So our stakeholders are as follows. We need our Senior Directors of MedStar Institution of Innovation, Senior Directors of MedStar Cytel, and Senior Directors of MedStar Telehealth. Our key stakeholders that are involved in the process of making sure that patients have a reduced or free service of telehealth are as follows. MedStar providers, MedStar support center staff, patients, legal counsel, MedStar telehealth operations team, MedStar telehealth IT, and marketing team. Now, what are some of our program components? What are some of our goals and objectives when dealing with this initiative? So our first component is provide the telehealth support center team with robust training and education on vetting patients for eligibility for free telehealth services. Also train on how to produce, distribute, and manage coupon codes. And this is what we need from our telehealth support center team. Data analytics Data and analytics team will manage rates of patients that are eligible for free telehealth services and calculate costs, and then increase in access to care. Also, compare patients' experience to those that pay. So we like to compare the experience of those that pay to those that are not paying, just to make sure that they're getting a similar experience or the same experience when interacting with the telehealth um, platform. Component number 3. Marketing team and telehealth senior directors manage community awareness and patient education content regarding the eligibility and use of the telehealth service. So we want to make sure that our community is aware of what's actually happening, what actually is going on. So in doing so, we need to create content and education for them so that they can then make a educated decision on how they can proceed in using telehealth as a means of healthcare. So the coupon code is the mantra of how to allow patients to get free or reduced telehealth services. So Meso Telehealth uses the Amwell platform, which enables the connection of patients with clinicians over a secure video. Amwell sells this platform as a subscription service to healthcare providers to put their medical professionals online and its proprietary software development kit. This platform has the ability to provide coupon codes to render discount services to patients. So this would be the code they will give to patients in order for them to have free telehealth services. Now, what are we asking? So we're asking for a targeted population fee exemption based on income assessment. We're asking for stakeholder buy-in, making sure that everyone is invested in this endeavor. We're asking for sensitivity training. Right? It's important that all of our staff is able to manage the patient clientele that might be coming in based on this new population that we'll be serving within the within the district and DMV. We're asking to provide necessary employees to determine and manage eligibility eligible patients. So we need the staff to enable us to fulfill this goal. We need staff to vet our patients just to make sure that they're eligible. We need patients to support all populations just to make sure that they're able to use the platform with very little connectivity problems, with very little errors, so that they can have a successful and pleasurable visit on our platform. And we're ultimately asking for equitable healthcare opportunities for all. It's important that we build these bridges so that more individuals can have access to healthcare. And I think that's what's the most important part of this presentation is access, making sure that we can increase that access. And I believe that telehealth has the ability to do so. And creating this access, creating this coupon code for individuals to use this platform for free will increase access of care. Thank you so much for your attention and participating in this presentation. If you have any questions, now is the time. Thank you.